Back to Life 5-minute chiropractic series video workshops. We are on new patient orientation and we just finished going around. So we're going to start a new one. And the reason we do this, one, is because we always get new patients. And then two, we know most people we're trying to give people a short amount of information so they can stay motivated on top of things. We know people are really busy, especially in our area where our practice is. And so we're just trying to keep people motivated and excited so they can watch these little 5-minute series. So, and then we actually do offer the new patient orientation for anybody that needs one. If they want the full-length one, we actually will do it for them. But we're just trying to keep people motivated. So I got my timer ready. So here we go. 5 minutes. New patient orientation. So, steps to less pain and wellness. Our goal is to get you back to life through chiropractic care and lifestyle changes. We know, and the question when you are thinking about chiropractic is if there's a spinal misalignment, subluxation, causing interference to the nervous system that is not allowing your body to function properly. So if the question is, if you're doing lots of things and trying a lot of different things, and you're not getting well, and you're going to the best places in the whole world, or you're not doing anything and you're just not getting well, then you might ask yourself, what is going on? So if you're at a chiropractic office, then what is the misalignment that's causing you to not get well? So research confirms that making lifestyle changes through your diet, exercise, and the way you think will improve your overall health. So, just clearing up subluxations, will cause a lot of things to get well, but then sometimes you need to make some lifestyle changes so your subluxations don't come right back. So is spinal misalignment a factor in the health problem that you're experiencing, and why is your problem not improving? Those are the questions that people want to know. So our first goal at Back to Life Chiropractic is to determine if there is a spinal misalignment, which is called a subluxation, and that is a possible factor affecting your health. So a subluxation, we'll talk about that later in the new patient orientation. So goal number 2 is to determine your overall health score. So we're trying to figure out where you are on this wellness scale. Are you in optimal health, good health, maintaining health, poor health, disease? So we're always surprised how many people think they're in this on their intake form when they're really not. They're more down here. And if you're taking a lot of medicines and things, you're already down here. Number 3, developing treatment based on your goals to improve your spinal misalignment and subluxation and your health score. So, and once we figure out if you do have a subluxation and where you are in your lifestyle, then we're going to determine where you are and your treatment plan for you. So our 4th goal is treating your spinal misalignment, subluxations through chiropractic adjustments, monitoring your overall health score, and providing services that improve your health through lifestyle modifications. That's our 4th goal. Our 5th goal is to help you help others get back to life. So once we've helped you, it actually would be nice to turn around and for you to help someone else. So we try to have things for you to do to help other people get back to life too. So one of those, going back to that, one of those is actually starting a small group and trying to get people to do the Back to Life system. And the Back to Life system's on our website. And then also we try to get you to refer people in. And then we actually have some community programs that you can do for your work and for your church. And there's a lot of things that we have available. We have a team mission. So there's a lot of stuff that we do for you once you get well. So this is attitude. So one of the things you have to change when you're going to the chiropractor is, sick care versus wellness care. So you got to make an attitude adjustment. So when you feel great, full of energy, and have no symptoms, do you wake up thinking I should call my doctor today? Typically, you call your medical doctor only when you're sick or feeling poorly. So sick care is very important in time of crisis. We're not against sick care and MDs and things when you're in crisis, but just understanding that doesn't have anything to do with health. So we have froze up here. It's very interesting. Let's touch the screen. So another attitude is that drugs are the answer. So if you have a headache, what do you take? If you have high blood pressure, what do you take? If you have a cold, what do you take? If you have pain, what do you take? If you have gastric reflux, what do you take? If you have poor circulation in your legs, what do you take? If your stomach hurts, what do you take? If you're depressed, what do you take? So a lot of people's attitude is when you have a problem, then you're going to take something to try to fix it. So, but unfortunately, this doesn't always work. And so, the third leading cause of death in the United States is like $250,000 death every year. Normal medical care. So, 12,000 unnecessary surgery, 7,000 medication errors in hospitals, 20,000 other errors in hospitals, 8,000 infections in hospitals. So, there's total 250,000 deaths. This was a little bit older information, but they just had a new thing just came out that was almost exactly like this. I need to update this, but I mean, came up with the same information. So, well, there's our 5 minutes. So, but so taking drugs is not the answer if it's the 30 leading cause of death in the United States. I mean, eventually you have to figure out how to make a lifestyle change and let your body heal itself naturally. So we'll talk about that next time we do the new patient orientation. And if you're trying to figure out what's going on with what workshops coming up next, you got to go to the calendar of events.